Good evening, everyone, and welcome to today's session. We are going to have a very exciting quiz shortly. I'm just waiting for all the students who paid the fee and got the ticket to join the quiz. We are going to have 30 rapid fire questions in pharmacology, which are going to ignite all that required intellectual curiosity, enthusiasm to master the pharmacology. So we have two players, Muhurt, Rajita, who could be able to log in. It's very simple. You just, in order to play the game, you need to see, this is a link I typed just now. You need to go to this link and click on the link. The moment you click on the link, it will take you to a point where you need to make payment of 50 rupees. The moment you make the payment, you will get an email in which you have the link where you can join the game. Very simple process. Still, if you have any problem with that, please call 900868-356. You will receive the WhatsApp of that quiz game link. Okay, so what I typed is basically the link to make the payment and buy the ticket to get into this. Just the way Muhurt and Rajita have made a payment. Okay, it's a very simple process. I'm just waiting for all the players to join because almost all I can see 10 people paid, but I could not be able to see all of them. Maybe they just got that code. See, after you make the payment, you check your email, you will get one image. Just open that image. In that you have that link which will give you an entry into the game. So we will give a little time at least for 5 players. Very good. 001 join the game. So, good evening, everyone, and very good. We have 6 players to fight today. James Bond, Muhurt, Y, 6 players. Praveen Mishra, 001, and everybody. So, those who are online, sorry, I had a little power shortage, and because of that, there was an interruption. So, let us start the game. Even if you are a little late, don't worry. Please don't forget, you just need to use this payment link in order to buy the ticket. Buy the ticket here, and then you will get the link to join the game. So let us see who is going to win the top-notch prize of 40,000 rupees. Now, doctor, you have always 10 seconds time because it's a rapid fire. Can online students punch whether you are able to hear the voice clearly? Yeah. Myositis, deranged LFTs, they're all the side effects of which drug? Come on, punch your answers, doctor. Very good. 3 of you are right. Statins are the ones that keeps 001 on the top, followed by Rajita and Praveen Mishra. Very good. The next, so all the hypolipidemic drugs you should be sure. Beta blocker overdose. How do you treat it? How is it treated? Who is going to give me a thumping answer for this question? Is it physostigmine or glucagon? Oh, physostigmine is the wrong answer. You will give atropine, not physostigmine. And you will give glucagon. Glucagon to treat the beta blocker overdose is what you need to remember. So we have 001 rocking with 169 points. Now, the next question, verapamil. You all know verapamil. Verapamil is not given in. Is it ventricular tachycardia, angina, or hypertension? Where is verapamil not given? Come on, punch your answer, doctor. So that's good. 4 of you are right. Ventricular tachycardia is a contraindication because verapamil being a calcium channel blocker, it has got a negative inotropic effect, and that will make the heart to go into failure if you happen to give it in. Ventricular tachycardia is what you need to remember. That's good. 001 is on the top, followed by Muhurt, James Bond, Y, Praveen Mishra. Oh, Rajita, no worries. Any moment, Rajita, you can go on to the top. Now, the next question. What will lead to worsening of heart failure? Punch your answer, doctor. Is it diltiazem, nifedipine? Diltiazem, nifedipine, which will worsen the heart failure? Actually, the question should be except. So diltiazem can worsen, but nifedipine doesn't, because nifedipine is more peripheral in action. Actually, key was given wrong, but still 4 of you could be able to make it. Yeah, actually key was opposite, the reverse. Yeah. So nifedipine, amlodipine, felodipine, they all affect the peripheral vascular smooth muscle more than the myocardium. That's the reason they don't lead to worsening of the heart failure. Is the exam point that you need to absolutely remember. Now, question number 5. Finasteride, the 5-alpha reductase inhibitor, where is it used? Is it male pattern baldness, ejaculation disorders, or in gynecomastia? Where do you use? Very good. 2 of you are right by saying male pattern baldness is a therapeutic indication for finasteride. Whereas ejaculation disorders, gynecomastia, they're all considered to be the adverse effects of the finasteride. That's the point you need to basically catch. So that keeps 001 on the top, followed by Muhurt. Excellent. Now, doctor, you should remember all the finasteride adverse effects, as I told you. Now, which of these gout drugs should not be started until 2 weeks after an acute attack of gout has settled? Until 2 weeks, you should not start. Which one? I think most of you will correctly answer. Very good. 4 of you are right by saying allopurinol. Be very sure about it, doctor. Very good. Now, that keeps 001 speeding up like anything. Good to see Nasi Bajia, Ram Brahma Reddy, Mohan Reddy, Oddity, Amit Jain, and many more. So, all of you can actually play. Playing makes it more fun, but for a small fee of $50, because you need to get that gaming feeling and seeing how you are progressing, right? So that's the point. Now, question number 7, you have to be very sure. Allopurinol reduces the renal clearance of which drug? And if you happen to combine that with allopurinol, then the marotoxicity of the drug will increase. So allopurinol reduces the renal clearance of which drug? Oh, not azathioprine. It is the cyclophosphamide. Only 2 of you are right. So, doc, you should remember, Muhurt is on the top. It looks like Muhurt is going to become the winner of 40,000 rupees in this tournament. Yes, doctor. Now, the next question. What is wrong about allopurinol? Allopurinol. False statement. Will it decrease the anticoagulant effect of the warfarin? Or if you combine it with amoxicillin, is there any rash? So option A is wrong. That means it increases the anticoagulant effect of the warfarin, not decrease. Of course. With allopurinol, if you combine amoxicillin, there is rash as an adverse effect, adverse drug reaction. That's what you need to remember. Now, doctor, that's good. Muhurt is really running fast on the top. Allopurinol increases the anticoagulant effect of warfarin. 20% of patients on allopurinol who are being given amoxicillin, they develop the rash, is what you need to remember. Now, what are the side effects of non-selective monoamine oxidase inhibitors? Except. So what are the adverse effects of non-selective MAO inhibitors? Very good. Hypertensive reaction with tyramine containing foods. Yes, it is an adverse reaction. There are anticholinergic effects because of non-selective MAO inhibitors. True. But atypical depression is not a feature. In fact, MAO inhibitors are used in the treatment of atypical depression. That's the point you need to basically carry. Right, doc? Now, the next question. More sedative tricyclic. Which one is more sedative tricyclic? Punctual answer, doctor. Is it imipramine, amitriptyline, lofipramine, or nortriptyline? Very good. 3 of you are right. Amitriptyline is most sedative among the tricyclics, is what you need to remember. So generally, if we open the book, we are asked to read tricyclics, MAO inhibitors. We feel, oh my God, should I read? But if you participate in rapid fire quiz session with Dr. Murali Bharadwaz, and when you see your competitors, your friends, Spardaya, Vardhathey Vidya, so competition expands, the curiosity required to amass the knowledge, and all the winning, losing of the NEET PG entrance is all about not the knowledge, brain and all that. Perseverance, focus, and that enthusiasm to learn, to compete, that should be alive in you, doctor, every day, every moment. That's the only way that you can become a winner. So tomorrow morning 10 a.m. we have the first set of the tennis of our full-scale grand test, 100 questions. Morning 10 o'clock to 11:30 we will play 100 MCQs. Then we'll take a break. Then 1 o'clock to 2:30 we will play another set of 100 MCQs. Then we take a break. Then afternoon 3 p.m. to 4:30 we will play the last set of 100 MCQs. Suppose if I leave you a online question paper, you keep thinking that kal karenge, parso karenge, baad mein karenge, pura kyun karna. That kind of lethargy you will be stuck up with when you subscribe to most of these online tests. So I want to make you to play with me, with all the friends across the country in a quiz manner, right? So you need to pay 50 rupees for the every quiz, three quizzes, and in another 1 hour we will upload the ticket buying link and also the YouTube link of the timings. But morning 10 a.m. we are going to start the full-scale grand test, and by the time evening we revise all 300 questions. We'll play 300 questions. You know, life is supposed to be, learning is supposed to be playing. You should enjoy it like a play. So by the time it is evening, you will recognize how is 001, how is everybody doing, why I am not able to do, why Muhurit is able to answer, why James Bond answered, why Rajita answered, why Mishra answered. That is called Spardaya Vardhathey Vidya, which will ignite you to once more restart your preparation. The entire next week you should be fully ignited and fully loaded. Now, doctor, you need to remember all special unique features of each of the various tricyclics. Now, overdose of tricyclic antidepressants cause all these things except sinus tachycardia. What is the effect of them on QT interval and on the QRS complex? This is a very standard question. Only 2 of you correctly answered. There is a widening of QT interval when there is an overdose of tricyclics, because tricyclics have got a anticholinergic effect. That's the point you need to appreciate. Very good. So 001 is on the top of the list. Very good. Now, doctor, the next question. In tricyclic poisoning, what is contraindicated? Is IV bicarbonate, is lignocaine or flecainide, which is contraindicated in tricyclic poisoning? Wow, 2. Right? So you have equally made a mistake. So you need to remember, flecainide, like antiarrhythmics, are also proarrhythmic, which are not permitted in tricyclic poisoning, is what you need to remember. That's good. Only Y is able to correctly answer, even Praveen Mishra also. Now, doctor, IV bicarbonate, it will reduce the risk of seizures and arrhythmias. Similarly, lignocaine typically is used as a first-line drug, but class 1A, quinidine and class 1C, flecainide, they are contraindicated because they lead to prolongation of the depolarization, is what you have to emphatically remember. Now, the next question. What is the wrong statement about tricyclic poisoning? Is flecainide contraindicated? Is amiodarone contraindicated? Is dialysis effective? Do you use an intravenous lipid emulsion? Dialysis is ineffective, not effective in tricyclic poisoning. That is the point you need to remember. One of the most frequently asked question in every exam. What is the role of dialysis? Is it effective or ineffective in tricyclic poisoning? Is one of the favorite questions of the examiner. So that keeps James Bond and Praveen Mishra, who are on the top of the game. Very good. Now, doctor. Intravenous lipid emulsion. It is used to bind the free drug and reduce the toxicity, but dialysis is ineffective, is what you need to understand. Now, we are with question 14. What's the wrong statement? Will tricyclics cause SADH? Can you use flumazenil when there is a benzodiazepine plus tricyclic toxicity? You cannot use. Only 3 of you are correct. So you need to remember only Y, James Bond, Praveen Mishra. Correctly answered. Excellent. So whenever tricyclic plus benzodiazepine, combined poisoning whenever it occurs, don't use flumazenil. It's a very, very important principle, doctor. But tricyclics is one of the drugs implicated to lead to SIADH. That's the point you need to appreciate. Now, what is wrong among these? Is sertraline contraindicated in post-MI? Is fluoxetine is drug of choice when an antidepressant is indicated? Will citalopram increase the QT interval? Citalopram increases the QT interval. Fluoxetine is the drug of choice whenever an antidepressant is indicated. And sertraline is not contraindicated. In fact, post-MI, if you want to use an antidepressant, if your patient is crying, oh my doctor, why did I get this heart attack? Really very depressed, then sertraline is the drug which is still safe in the post-MI patient, is one of the favorite MCQ, whether you go for USMLE or the NEET PG exam. Very good. So, doctor, this clearly says, if you are not doing good in this quiz, you should identify tricyclic antidepressants. Immediately you have to go back to onlinemmbbs.com, video library and do revision. Second, you need to do the revision of MAVO inhibitors, another favorite topic. Then third, you have to make it a point to brush your basics on tricyclic poisoning. So every quiz, at least if you can pick up 5-6 important topics that you need to improve, I'm successful in driving this quiz. But please buy a small ticket and play the game. That's my advice to all of you. So tomorrow morning, 10 o'clock, we will start 10 to 11:30, first tennis quiz, tennis shot. Left, right, left, right, left, right. We'll finish 100 questions. We'll take a break. Then once more at 12:30, we'll start and play another 100 questions of second block. And lastly, in the evening, we will have third block of 100 questions. So complete 300 questions, just like the NEET PG full exam. Get ready. ready to play on every Sunday with Dr. Murali Bharadwaz and get ready for the NEET PG exam. Now, doctor, SSRIs are considered first-line treatment for the majority of the patients with depression. That's a thing you need to remember. Now, SSRI, which is the drug of choice in children and adolescents. What is your answer, doctor? Which is the drug of choice in children and adolescents? Oh, fluoxetine. Please don't forget this favorite rapid fire question. Tomorrow's exam, this bit is going to definitely come, and you are the only ones who is going to answer when they ask this question. So Dr. 001, Muhurt, James Bond, Praveen Mishra, rocking, excellent. Now, the next question. In postnatal depression, which is the antidepressant which is best avoided? One of the favorite questions of the examiner when you go to USMLE and other questions, other exams. So, doctor, in postnatal depression, fluoxetine is best avoided, but sertraline, paroxetine can very much be given. So all these small unique things are there, no doctor. They're all like single liners. You have to be 100% sure. So in postnatal depression, fluoxetine is best avoided because it has got a long half-life and it is going to affect. Now, SSRI, which is used in post-traumatic stress disorder, punch. See, when you play a quiz, when you make a guess, your enthusiasm to read the topic of SSRIs, MAO inhibitors, tricyclics, everything will get ignited. That's my point to you. After this session is over, if you really enjoyed this challenge, you need to go back to the onlinemmbbs.com video library where you have wonderful lectures on in the topic of psychiatry. So, doctor, the SSRI which is used in treatment for post-traumatic stress disorder is paroxetine, is what you need to remember. So, that brings Sarang into the game. So, we have 7 players. 001 rocks as usual. So, doctor, last 9 questions. Safest antidepressant to prescribe along with warfarin. In a patient who is taking warfarin, what is the safest antidepressant to prescribe with the warfarin? Come on, punch your answer. Doctor. Sertraline. 3 of you are right. Proud of you. Very good. So that makes James Bond, Y and Mishra ji, psychiatric pharmacology में एकदम छुपे रुस्तुम निकला. Excellent. Very good, Mishra. So sertraline, citalopram, they appear to be the safest antidepressants to prescribe with warfarin, is what you need to remember. Now, last 8 questions. The serotonin antagonist which is used to treat the serotonin syndrome. These are all except. What are the serotonin antagonists which you will use whenever there is a serotonin syndrome? Whoa. Cyproheptadine, methysergide, both of them are used as serotonin antagonists when you need to treat the serotonin syndrome, is what you need to emphatically remember. Okay? So, none of you could make it, no worries. So now, doctor, the next 8 questions, Antipsychotics act on which dopamine receptor as antagonist? D1, D2, D3, D1, D2, D3. Where does they act? Excellent. 7 out of 7 of you have killed this question. I'm proud of you guys. The future NEET PG toppers. I'm waiting for that day to come where our Bahubalis are going to kill the paper. So that's good, Doctor. 001, James Bond, Y. Muhurit, Praveen Mishra, Rajita, excellent. All of you correctly answered. Now, side effects of the antipsychotics include all except. What are the side effects? Is there any galactoria, diabetes insipidus, is there any prolonged QT, or are they antimuscarinic? Excellent. There is galactoria. Actually, the correct answer is C. I'm sorry, there is a mistake in the key because they lead to SADH, not to diabetes insipidus. So the correct answer is actually C. Okay. So 4 of you have rightly answered but missed the score. Sorry about that. So when antipsychotics are used in elderly, they increase the risk of stroke and they increase the risk of venous thromboembolism. So what are the other side effects of antipsychotics? They have antimuscarinic effects with the dry mouth. They lead to sedation, weight gain, raised prolactin leading to galactoria. They lead to SADH, they impair the glucose tolerance, they can lead to neuroleptic malignant syndrome. They reduce the seizure threshold and they prolong the QT interval is what you need to ultimately remember. Now, doctor, the next question. What is wrong statement about phenothiazines? Are phenothiazines antiemetics? Are they antipsychotics? Can you use them in migraine? Are they contraindicated in acute porphyria? So what is the wrong statement? They are used in migraine, correct. They are antipsychotic, right. They are antiemetic, right. And they are indicated in acute porphyria. That is the point you need to appreciate. So that keeps 001 as usual onto the top position. So doctor, phenothiazines have a antiemetic, antipsychotic, making them the medication of the choice whenever there is a acute porphyria episodes is what you have to basically remember. And they can very much be used in migraine is what you need to understand. Very good to see 27 online warriors. Maybe you are a little late, or maybe you thought you had a confusion in making the payment of the ticket. So, doctor, adverse effect of atypical antipsychotics include agranulocytosis, weight gain. But what is the advantage of atypical antipsychotics compared to typical like haloperidol? Extrapyramidal side effects are less in case of atypical antipsychotics like clozapine is what you need to remember. So that keeps the 001 on the top. So doctor, no worries. Please remember every Sunday morning 10 a.m. to 11:30. We play 100 questions. You don't need to do anything. Just come, open up the YouTube, and then go to the link on the smartphone and start playing the quiz. There is no psychological preparation for you required. Oh, let me prepare and sit that 3 hours of 300 MCQs of NEET PG full scale. Not required. You can keep playing every question instantly, right? And I keep giving you a quick explanation wherever required. And we finish 100 questions. 10 to 11, 30, 100 MCQs. Then once more, we started 12:30 to 2 p.m. Another 100 MCQs. Then we'll have a lunch break. Then 3 to 4:30 p.m. we will play the last set. And you are completing all 300 questions of full scale NEET PG. पूरा 19 subjects का एक painting हो जाएगा. So you will get the links where you need to pay 50 rupees and get into each of this set of the quiz along with the classmates. Tonight we will host it on the YouTube. The moment you go to that particular payment link and make the payment, immediately you will get the link of the game link you will get. And just log into the game link and 10 o'clock morning play and take a chance to have a full spectrum, 19 subjects revision, right? So that is the deal. So doctor, atypical antipsychotics, two adverse effects, weight gain and agranulocytosis, as in the case of the clozapine. Now, doctor, let's go to the next question. Concomitant treatment of antipsychotics with other medications increase the risk of neuroleptic malignant syndrome. What are the other drugs plus antipsychotics will lead to NMS? Very good. Lithium, anticholinergics, they all can worsen NMS. Bromocriptine is used to treat the NMS, neuroleptic malignant syndrome. If you go back to the onlinemmbbs.com video library, you have a quick 20-minute video lecture on NMS, which tonight only you need to do the revision. So keep a 200 pages notebook while playing the quiz and make a note. Okay, I need to improve in this topic, I need to revise this topic, I need to revise this topic. Like that, 5-6 topics, try to shortlist. These are all high-yield topics. I conduct the quiz with most high-yield topics sure to come in tomorrow's NEET PG FMG exam. And I will also go to that level of depth which commonly examiners want to touch you that deep. And I will only test you in all these rapid fire quizzes, the most high-yield facts. So that is the reason, no worries at all. So, doctor, concomitant treatment with lithium or anticholinergics increase the risk of neuroleptic malignant syndrome is what you need to remember. The last two questions going to decide who is going to be the topper and take away 40,000 rupees worth of onlinemmbbs.com video library as a prize. What is wrong about serotonin syndrome versus neuroleptic malignant syndrome? Both of them look clinically similar, but there are differences. Serotonin syndrome can develop over 24 hours very rapidly. Then resolution of the neuroleptic malignant syndrome will take almost 9 days. Myoclonus, tremors, hyperreflexia. They are all more common in serotonin syndrome than neuroleptic malignant syndrome. That is the point you need to appreciate. Now, doctor. So the serotonin syndrome versus neuroleptic malignant syndrome, you have to be 100% sure. Now, doctor, 27th question. Malignant hyperthermia, which chromosome lucky number you are going to remember? Is it 16? Is it 19? Is it 21? Punch, 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 punch. Correct answer. Wow. None of you could get a guess. This kind of numerical things, we can't help it. You have to make a list of them. Chromosome 19. Please remember. The last question for the today's evening of this wonderful quiz. James Bond is on the top. 001 is trailing behind. अपने निकटतम प्रतिद्वंदी James Bond से कितना पॉइंट? 15 पॉइंट्स पीछे पड़ गया. अभी देखेंगे. So, Doctor, yes, the last question deciding the fate. Oculogyric crisis, which is an acute dystonia, is caused by all these drugs except. Who is going to give you the correct answer? The acute dystonia. Whoa! One and only one. Is it 001 or is it James Bond? Is it 001 or James Bond? Computer Mahoday, abhi batao kaun kiya correct answer? Whoa! James Bond, James Bond, James Bond. Ta 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 ta. 007 is the winner of the today's evening quiz. Very good. Abhishek Day is our James Bond for this wonderful evening. So Abhishek, take a screenshot of this, send to our helpline 9000868-356. 9000868-356 and claim your 40,000 rupees prize. Doctor, I hope you're all sitting there. I'm sitting here enjoying the journey of learning together, preparing together every day. Okay, so end of this, identify where you want to quickly improve tonight. Okay, and tomorrow I want to see you all morning 10 o'clock. अच्छा breakfast करो, smartphone पकड़ो, YouTube को देखो, जरा जाके 50 rupees का fee pay करो, right? And get the link. Another 1 hour we will host all the YouTube shows and also the link where you need to make the payment and join the quiz. Also invite your friends, tell them the whole day in about 1.5 hour tennis, we will finish 300 questions of full-scale grand test playing with Dr. Murali Bharadwaz. Good night and enjoy a great time.